jobs. Please, we're encouraging you to download and register on our Complete Health app. You can find it on Play Store, on Google Play Store. We'll just give you about 1 minute, just check your phones and download Complete Health app, go through it, and your health in your hands anytime, anywhere. We encourage you to please download the Complete Health app on your Google Play Store. We also have NaviHealth.ai, is a digital patient navigation, a directory for public and private healthcare facilities and providers around you. So you just need to sign up on www.navihealth.ai and find facilities around you, leave your reviews, and then in the chat with
I'll walk you through the sign-up process on NaviHealth. The first step is to enter navihealth.ai into your web browser. Next, click on the sign-up button you can find below. Choose from one of the options to register either as a patient, facility, or healthcare provider. Input your details. You can use a registered phone number or email address of choice. But please note that using a registered phone number is compulsory. Make sure to create a strong password. Once you have done that, click on the Finish button to be redirected to input a 6-digit verification code. Get this code sent to your email or your phone number and click to verify the button to complete the sign-up process to get started on NaviHealth. Once the sign-up process is complete, search for a healthcare service close to your location, and once the result pops up, you can search for a facility close to your location. Once you search for a facility, you can click to leave a review on that facility. Make sure your reviews are 100% authentic and original. Input a display name which is not your profile. And thank you for using NaviHealth.
Yes, thank you very much. Please follow us on our social media platforms. You're on Facebook, Instagram, X, LinkedIn, and YouTube. So you can stay abreast on what MDoc is doing, stay abreast on our activities, our programs, to just keep yourself informed. And please, we'd like you to know that this session will be recorded. This session is also being streamed to YouTube. Just some basic housekeeping rules. We also encourage you to please leave your comments in the chat room. If you have questions, we will definitely attend to them. We encourage you to also keep your camera on. It would be nice for us to see your faces. And if you have any question, please, you can raise your hand or you can keep it in the chat. Thank you. Please ensure your comments are respectful. Everyone's opinion is valid. Thank you very much. This is our agenda for today. All right, so we'll be going into our pre-quiz. Please, can we confirm that we can see the pre-quiz listed on our screen? We still have some people joining. Welcome. Thank you very much. Currently, we are at pre-quiz. So before our speaker comes up, we just want to know your knowledge right now, what you know about conception, reproductive health. Apologies, everyone. We'll be launching the pre-quiz now. Yes. There's a pre-quiz currently showing on your screen. We encourage you to please fill in the quiz. Let's see what you know now before our speaker comes up and falls in from our knowledge. If you can't see it on your screen, please let us know in the chat so that we can direct you. You just need to look down, press on the icon that says more, and then you see poll and quiz there. So we have about a few minutes to fill the quiz. Please, we're encouraging you to kindly fill in the quiz. Don't worry, no one is getting any. Just fill it in what you know. No scores. Just want to know. Thank you so much. I can see some people filling it in already. Thank you, thank you. We're encouraging others to please participate. Thank you very much. Thank you very much. I can see people filling in the quiz. Thank you so much. We are begging, we are admonishing to please fill in the quiz. It's on your screen. If it's not showing on your screen, please let us know in the chat and then we'll direct you. You just need to look down, go to there's a place that says more, the more option, and then you see the poll and the quiz there. For the participants watching on YouTube, please check the chat option. You'll see the link to the Google form so you can fill in the quiz. Thank you very much. Thank you for joining on YouTube, on Zoom. We're happy to have you here. Thank you for joining our session. Kindly encouraging to please fill in the quiz currently showing on your screen. Thank you very much. Thank you. We have 1 more minute to go. Thank you very much. We have 1 more minute to go. Thank you very much. Please participate in the second session quiz. It just takes about 1-2 seconds for you to just fill it in. Thank you very much. Thank you so much for filling in the quiz. Right now, we'll be moving to our subject matter. Our speaker is here. We have Dr. Alima Abikewuyo. Please, a round of applause for her in the chat. A round of applause for her with emojis. Dr. Alima is a medical doctor with over 10 years of experience in sexual and reproductive health. Currently, she's undergoing specialty training in general practice in UK. She's passionate about education, health education and advocacy. Academic and professional passion for sexual and reproductive health was the focus of her master's in public health thesis. She's married to her husband, who encouraged her pursuit of a master's degree, and she's a mother to 3 lovely children. Dr. Alima, thank you very much. You're welcome. Please, a round of applause for our for our speaker. A round of applause for her. Let's cheer her on. Let's cheer her on. Right, over to you, Dr. Lima.
Thank you very much, Praise, for having me on your platform. And I must thank every one of you for coming here today. I mean, the turnout of attendance is very impressive. I can see some of you at work and you're taking your time to like listen, to get empowered is really, really encouraging. And thank you very much. I really appreciate all the claps and the kudos. So today we'll be talking about empowered choices, understanding safe sex, contraception, and reproductive health. And I'm indeed glad that we have guys on the platform. Like there are guys that can see guys. It's really encouraging. So I'll be using this outline, the introduction. We'll have some objectives. We'll have an interactive quiz, just like you had before this lecture. And I'll be giving my final thoughts. So as a way of introduction, I'm sure you saw some key words in the topic, which I decided to just pick out: empowerment, reproductive health. So as a way of definition, empowerment is the process of gaining knowledge, confidence, and control over one's life and decisions, just like you're doing today. I mean, you coming to this platform to listen to what we have to say is a form of empowerment. And when this is applied to sexual and reproductive health, empowerment means having the ability to make informed, respectful, and independent choices about your body, relationships, and future. Now, reproductive health simply means complete physical, mental, and social well-being in all matters related to reproductive health. It goes beyond just avoiding disease or unplanned pregnancies. It includes the right to access safe, respectful healthcare and to make personal decisions about sex, contraception, and fertility, including family planning. Together, imagine having empowerment and reproductive health. I mean, this forms the foundation for individuals, especially young adults like ourselves, to lead safe, informed, and fulfilling lives. Understanding your rights, understanding your options, and how to protect your well-being is not just about health, it's about freedom, it's about respect, and it's about dignity. So if you're feeling empowered, please type it in the chat box. So as a way of objectives, we'll be looking at what safe sex is, would identify common STIs and prevention, would explore contraceptive options and how they work, guide on accessing sexual health, and foster confidence in conversations about consent and boundaries. So defining what safe sex is, safe sex is referred to as unprotected sex. I mean, sorry, safe sex is basically protected sex, and it is defined as sexual activity engaged by people who have taken precautions to protect themselves against sexually transmitted infections and diseases such as AIDS. I mean, in the 80s then, when AIDS was initially like discovered, when you talk about protected sex, like it's always like, oh, I don't want to get HIV, but it's just beyond STIs alone. It's about preventing pregnancy, it's about making an informed decision, it's about taking your own decision into your own hands and into your own hands, and not just having to expose yourself to various things without whereby you will be facing the consequence of all of this action. So individuals use this term safe sex to refer to the protection against pregnancy, HIV, AIDS, and other sexually transmitted diseases. Even if you're not going to pick anything at all from this lecture, please kindly pick these key points of safe sex. It's the use of condoms and barriers. It's a mutual monogamy or tested or having sex with tested partners, and it also entails regular STI screening. So basically, you're using condoms, you're having protected sex with people that have tested themselves before even engaging any form of sexual activity with them. So now, why does this really matter? It empowers people to make informed choices. It protects one from physical and emotional health, and it also reduces anxiety about the consequences. I mean, imagine I remember having a patient like years ago, and it was an experience. She told us then, like, she remembers her friend telling her that, oh, you need to engage in safe sex even if you have to, because I would always encourage, even before marriage, if you do not need to engage in sexual intercourse. And she remembers all of those lectures vividly, and she was like, you know what, I need to take I need to take a step back. And she came to the clinic, she got counseling, and she was better informed as to moving forward with regards to safe sex. Next slide, please. So in terms of the sexually transmitted infection, it's been categorized, it's been grouped into various forms. We have the viral sexually transmitted diseases, which we have HIV and AIDS. We have herpes simplex virus type 1 and type 2. We have the human papilloma virus, and we also have hepatitis B and C. For the bacterial sexually transmitted infection, we have syphilis, we have gonorrhea. I'm sure we've all heard of gonorrhea, which is very common. Chlamydia is equally very common. So for the parasitic STIs, we have trichomoniasis, we have pubic lice, and we have scabies. Now, what sexually transmitted infections causes, particularly in females, it could cause vulvovaginitis, it could cause ballantitis, it could also cause vaginal thrush. Please do not bother yourself about these fancy words. They're just medical jargons. So the interesting thing about sexually transmitted infection is most times they are usually asymptomatic. However, common symptoms could include abnormal vaginal discharge, a burning sensation when peeing, penile discharge, white, it could be yellowish, it could be greenish discharge, pain or swelling on both testicles. I mean, this is not very common. Vaginal bleed between periods or after sexual intercourse. This particular point might not necessarily be limited to sexually transmitted infection alone. So it's very, very important to seek medical advice. I'm going to cite an example again. I remember having a patient years back. I mean, this patient was a male patient actually, and he had this ongoing discharge. He felt really ashamed to speak about it. Again, there's a lot of stigma with sexually transmitted infection. A lot of people are not willing to speak about it. Please, we're in the digital era. Some of these services could be gotten online. Please do not feel ashamed to speak about your health. If you think things are not right, I'm definitely sure you would know. Please seek help. It is very, very important because some of these things, they could result in potential consequences or complications later in life. The long-term effects, such as, just like I've said, infertility, chronic pain, or it could even increase your risk of, one's risk of becoming of being infected with HIV and AIDS. So symptoms still, like we're still talking about the symptoms. So I'm particularly going to talk about human papilloma virus, which obviously is the most common STI globally. Certain high risk HPV types, type 16 and 18, can cause 95% of cervical cancer cases. I mean, this virus, in addition to other lifestyle risks such as smoking and some other things like that, are all put together that and this could cause cervical cancer risk. So most human papilloma virus infections are asymptomatic, just like we've said, and clear on their own, but persistent infection can lead to cancer. HPV vaccination is mostly effective in ages 9 and 26 years. I know there are some mothers amongst us here today. I would really encourage us, because getting this vaccine is not in the Nigerian schedule, is not in the immunization schedule. So this is something that will really encourage us to, pitch into once the girls, once they are getting of age, above 9, or even before any form of sexual exposure, it is very, very much encouraged to get these vaccines for them. Regular cervical cancer screening is also very important for, elderly, well, not necessarily elderly, women of reproductive age, pap smear, and HPV. Again, this is something that needs to be done intentionally because, in Nigeria, we all know that no one is going to send you a letter and say, oh, you're due for a pap smear or you're due for your for some sort of screening or the other. Where I am currently, you get letters, and if you do all these tests, once it's clear, you get letters in the next 3 or 5 years. So I would encourage us to put it in our diary, be very intentional about some of these things because they are life-saving and they could be very, very helpful in preventing cancers, in preventing cervical cancer. Condom use and limiting sexual partners can reduce HPV transmission risk. HPV prevention, cervical cancer prevention, it is safe, it is cost-effective, and it is life-saving. So all of these things are very important. So in terms of the prevention, we have the primary prevention, we have secondary, and we have tertiary. Primary prevention, basically, you're preventing it from occurring. So consistent and correct condom use is key. I'm not here sitting down and saying, for real, overall, I would say abstinence is key. But if you're not able to, please, consistent and correct condom use is very key. STI testing before new partners. There's nothing like, oh, I've never had it before, because I mean, some of these things are not, you can't even know by mere looking at someone. So one cannot tell you, I've never had it before, and you just take it hook, line, and sinker. It's very important to have all of these testings done. Vaccination is also very important. Open and honest partner communication is key. Limiting sexual partners as much as possible. This is equally key. So secondary prevention, this has happened. Now let's try to prevent it. So there's something called post-exposure prophylaxis, particularly in people that have been exposed to maybe someone that is maybe HIV, that is infected with HIV. Most times we always encourage that someone who has an exposure to someone who has got HIV should have post-exposure prophylaxis, and these medications are taken for about a month. Testing and treatment is equally important, particularly STIs. There are some STIs that are actually treatable, and some, I mean, like HIV, it's not like it's treatable, but I mean, you can be taking medications to reduce the viral load. Now, tertiary prevention, this has happened. This is basically treating the complications, things like cervical cancer, maybe has occurred. Now, it's also very important to go for screening to know the stage this cancer is, and prompt treatment is also like helpful. So now we'll move to contraception. I know a lot of people will be wondering, oh, what sort of contraception can I use? How does it work? So today I'm just going to briefly talk about, because contraception is quite voluminous. So basically, we have the barrier methods, we have the short-acting methods, we have the long-acting ones, we have the natural method, and we have the permanent method. So for the short-acting and barrier method, obviously barrier from the words, you can use condoms. For the short-acting, we have the pills, we have combined oral contraceptive pills, we have the single pill, progesterone only pills. Now, for the long acting, that's when you have the copper T, the implanon, like the ones that are fitted in the arm. Now we have the natural method. This was very common in those days, whereby people would monitor their ovulation. And I mean, this is not very reliable, because sometimes the menstrual cycle can be a bit chaotic due to various things. So it's always very important to seek help. Again, this is not something that you can just sit down and say, oh, I'll use this, I'll use that. A lot of factors are put in place when considering contraception. Now, permanent method, vasectomy, tubal ligation, these are things that people also consider. Now, how do they work? They either prevent ovulation, they change the mucus of the lining of the womb, and the permanent method, obviously from the name as it implies. Now, reproductive health and menstrual health, what is normal? So cycle, basically, it runs between 21 to 35 days. For the guys amongst us, we're basically talking about the menstrual cycle of a female, whereby they shed blood monthly, females shed blood monthly. And the cycle could run from 21 to 35 days, basically from one menstrual cycle. I mean, imagine a lady starting her menses today. The next time she'll be starting her menses, this cycle could run from 21 to 35 days, depending on the individual. And the bleeding is usually averaged between 2 to 7 days. Blood loss is between 30 to 80 mils. Now, what is also considered normal? Cycles that are fairly regular, mild to moderate cramps, absolutely normal. Bright to dark red color, very normal. Minor clotting, also normal. No bleeding between periods, that is what we consider as normal. Now, when do you need to seek for help? Bleeding lasting for more than 7 days, periods occurring more than once a month, skip for months, that's a regular menstrual period, severe cramps or heavy bleeding, this could be as a result of some swellings in the uterus that needs to be checked, bleeding after sex or between periods, this is not normal. Sudden changes in the cycle pattern, this is equally not normal. So you need to seek help when you're seeing all of these abnormalities. Menstrual health is very key to overall well-being. It supports early detection of reproductive issues, and it impacts education, work, and emotional health. And it allows for identification of irregularities through tracking. I mean, some people go as far as getting leave as a result of their menstrual cramps and all of that. So this is not out of place. So if you see someone that is having menstrual cramps and all of that, the least you could do to that person is to support the person, rather than just be like, oh, it's not just menstrual cycle. You are having it easy doesn't mean the other person is having it easy. So I really encourage every one of us to please support our girls. If they are in their period and they are having the cramps, please be there for them. Try to support them as much as you can. Please, next slide. So what are the online platforms which you can access reproductive health. MDoc Chem charts on complete health. I mean, at the beginning of this session, it was spoken about extensively as to how you can access some of this. And I know we are digital moms, we're digital girlies, we're digital Gen Zs. So we have all of these platforms in place. So My Access Clinic is also an important place that you can get some of these things. I would always encourage, I mean, the digital era, it encourages you getting some of this help one-on-one rather than going physically to the clinic. I would also encourage physical meeting. I mean, if you need to go, but sometimes we have this ideology that when you go physically, sometimes there could be judgments, there could be bias. It is completely normal for you to feel that way. And that is why some of these platforms are created. They are totally confidential. You can access one-to-one counseling, although some of these things are private that you might need to pay for. But unless all of these platforms, they are very key, they are very important, and they are very helpful in seeking reproductive health issues. Next slide, please. So other places you can access mental health services. Did I say sexual health services? We have the government hospitals and primary healthcare centers. For some of us that are in the universities, the university healthcare center is a very, very good place. I remember working in the university health center, and I remember then our pharmacy department would always put a pack of condom just at the entrance of the pharmacy without saying a word. And by the end of the day, when we go check the pack, it's totally empty. So we always encourage, we don't say anything. We don't even say, oh, pick something there. We just drop it there. And by the end of the day, we cannot find anything. It's normal. We are happy you're taking it. We're happy you're engaging in, we're okay with you engaging in safe and responsible sexual safe sex. Basically, that's what we're trying to preach, rather than facing the consequences of what unsafe sex could predispose one to. So other places you can access sexual health services include Planned Parenthood Federation of Nigeria, offers family planning, HIV testing, contraceptive, youth education. Society for Family Health is also a very good place to access sexual health, HIV, AIDS, and family planning programs. The websites are there. Mary Stopes Nigeria, Now Decades in Nigeria. These are websites that you can access sexual health services. Again, abstinence is key. Please take notes. If you're not married, if you're able to abstain, is very key. Now, so tips for young people. First of all, look for youth-friendly signs or ask for staff if they provide non-judgmental care. I know this is very important for a lot of young people out there. You don't want someone judging you. You don't want someone saying, oh, why are you doing this? So ask questions. It's not too much. Don't feel that any question you're asking is stupid. No matter the question, ask. You don't know. These are areas that needs education again and again and again. Insist on privacy. If you think you're being seen in an open place that you're not comfortable with, these are sensitive matters that should be discussed in privacy, and healthcare professionals provide confidentiality. We are bound to give you confidential discussion, except, I mean, if there is risk to life or anything, that's when we might need to break confidentiality. But it is important to know that confidentiality is key, and we are bound to provide that service. Bring a friend if you need to. Sometimes emotional support is very important. Physical support is also very important. So these are tips I would really encourage us to pick from this session. Now, talking about safety mechanism, consent and communication. I know this is an area that is not very clear in our own part of the world. It is important that the consent you're giving is clear. Yes is yes, no is no. You need to be enthusiastic about the consent. It's an ongoing agreement. I mean, you can say yes now, and while the process is ongoing, you say, you know what, I need to turn back. I need to make another decision. I'm not going again. It is normal for you to change. It's not for you to say, oh, because she said yes before and that's it. Consent could change. It's an ongoing agreement, not possible under coercion. You can't be intoxicated and say, oh, but she said yes. I mean, that person is not oriented. So please, consent is not to be taken under coercion when someone is intoxicated or under manipulation. Sexual rights and consent, even within marriage, is something that is applicable as well. There's something we also call boundaries and confidence. Communicate your limits. Communicate what you want. Communicate what you don't want. Respect other people's boundaries. If she says, do not touch me. If he says, do not touch me, please respect the boundary. Be assertive, be it male, be it female. Be assertive with your words. tell the person the way it is. Don't say, oh, but I said no doesn't mean I meant no. If you mean no, you say no. If you mean yes, you say yes. Please encourage mutual understanding, encourage conversation, learn to have that discussion. Don't just say, oh, but my silence, you should understand. No, communication is key and it's an ongoing thing. Please. Next slide, please. So I would like to talk about this myths and facts about sexual and reproductive health. So sometimes we have these people saying, oh, you can't get pregnant the first time you have sex. That's a myth. The fact is you can actually get pregnant anytime you are ovulating. So please always have this at the back of your mind. Ovulation, pregnancy is knocking. So please, you can get pregnant as far as you are ovulating. Condoms reduces pleasure. Condoms comes in different types. They protect lives and relationship. Aside protecting life, I mean, they give you less anxiety. Imagine having sex without using condoms. The next thing you'll be thinking of, oh God, I'm getting pregnant. I'm going to be pregnant. You will not be able to concentrate. You'll be having anxiety. Oh God, my period is not here. So please, it is key. There are various types. There are various flavors. In fact, they made some that the saints and all of that. There are different things in the market today. So you can easily pick for what you want. Contraceptives can cause infertility. This is also a very common myth. This is actually a myth. Most contraceptive methods are reversible. Fertility resumes after discontinuation. However, there are some hormonal contraceptives actually that they would always encourage you to stop maybe 6 months before you want to start getting before you want to start to get pregnant or anything. But it is key to know that contraceptives do not cause infertility. No, they do not. They are very good. They are very effective. Only women are responsible for contraception. No. Everybody, be it male, be it female, we are all responsible for reproductive issues. And this should be a conversation between yourself and your partner. So in conclusion, empowered choices are informed choices. Respect, communication, and consent are very fundamental, very foundational, please. It is very important to have the communication, respect everyone's opinions, their boundaries. Safe sex protects your health and your future. And access to education and services is very, very key. I'm going to end this session by telling you the story of someone that has really inspired me to continue in the line of sexual health. I remember back then in my previous workplace, it was a university setting. I mean, she was involved with in a form of sexual problem, sexual issue, and it involved her being exposed sexually, and she needed to take post-exposure prophylaxis. Thankfully, she was able to get good sexual and reproductive health service, and she was able to come out of that situation. And here she is today. She's a tech girl. I mean, she's Gen Z. She's making 6 figures now. And each time I look at her, I'm always very happy that she made empowered choices. She was empowered. She was able to get informed choices. She was able to get like good support from the system. So as much as possible, if you've not picked anything from this place today, please, safe sex is very pivotal to having your future. If you do not take safe sex importantly, it could derail you from your future. A whole lot of people have a lot of things they have set aside for their future. Please, as much as possible, think twice. Think about the consequences of not involving in safe sex and some of the things that it can result to. It could break dreams. It could shatter one's dreams. It could suddenly end one's very bright future. So as much as possible, I would really encourage us to engage in safe sex, please. Thank you very much.
Okay, thank you, Dr. Alima.
Oh, thank you for having me. Thank you.
For that really enlightening presentation, for highlighting the facts about safe sex and really helping us to debunk some of the myths when it comes to the use of contraceptives. So we'll take questions now. During your presentation, we had a number of questions from participants in the chat. So I'm going to highlight a few for us to go through. So the first one is, can emergency contraception replace birth control methods, and how can someone choose the right contraceptive method themselves?
That's a very lovely question. So, first of all, we need to understand what emergency contraception is. So, emergency contraception basically is contraception one uses as a result of being exposed to sexual activity during the ovulation period, and the person does not intend to get pregnant at that point. And I think the other part of the question is, can emergency contraception replace regular birth control? So it does not replace regular birth control. It's just an emergency, is a contingency plan put in place for to prevent pregnancy at that point in time. Once that emergency contraception is taken, because there are different forms, it could be in form of pills, it could be in form of IUCD, that's the implant. One needs to go back to the original contraceptive plan that the person has been taking. So this is just to prevent pregnancy at that point in time. Then how often should someone sexually active test for STIs? That's also a very brilliant question. So testing for STIs depends on various factors. If you have a mutual partner that is just one person, and you both know that you do not have other sexual partners, I mean, there may not be a need to test for STIs. But again, if you do not know this person and you do not know that this person has other sexual partners, as often as possible, as long as you are exposed sexually and you think, oh, you need to get tested. I mean, your intuition is key here. As long as you cannot vouch for the other person, if you can vouch for yourself that, oh, this is just the only person I'm having sexual intercourse with, but you are unable to vouch for that person, it is important that as long as you're exposed sexually to that person, you need to get tested. I hope that answers the question. But if you both have that mutual understanding that, oh, I do not have extra sexual partner, you're the only person I'm seeing, why not? I mean, you may not need to test yourself, you may not need to test yourself for sexually transmitted infection. Now, is it true that too much intake of prostanol can lead to infertility? Also a very good question. So prostanol basically is the tablet, the pill one takes to prevent pregnancy. Like, it's a form of contraception. Now, too much of it, regardless of whatever you're doing, there's moderation is key. So what I would say scientifically with regards to prostanol, if you're taking it if you're taking it excessively, it could distort the menstrual cycle. And if it distorts the menstrual cycle, you're not able to track your ovulation. And if you're not able to track your ovulation, obviously you cannot track your fertility period. And this could invariably affect the fertility. So it's not like it's going to make one infertile, but there's going to be a distortion in the menstrual cycle. And when there's a distortion in the menstrual cycle, ovulation is affected. And ovulation is also pivotal to getting pregnant. So I hope this answers the question. So it's not like it directly affects fertility, but it's a form of affectation on ovulation and invariably affects fertility. There's a common practice of young girls taking implants. Is this healthy practice? I'm not quite sure what you mean by Kende, that's Kende. I'm not quite sure what you mean by getting implants. Do you mean implant like in the hand, or is it copper T? If that's what you mean, I mean, this is a form of contraception. Implants is not something one takes regularly. It could be monthly. It's a form of long-term contraceptive method. I mean, sometimes some of these implants, it could be IUCD. It could be in the hand for 3 months. It could be in the hand for 1 year, 3 years. So it depends. But again, the question is common practice, young girls getting implants. Is this healthy practice? I mean, in terms of being healthy, it's a form of contraception. And this person is trying not to get pregnant. So if this is something that they prefer, I mean, why not? They can go for it. But again, contraception, seeking contraception is very important that we meet the special, I mean, we meet people that are able to advise, because contraception, you can't just wake up one morning and say, oh, this is the one I want to take, because there are a whole lot of factors involved. Blood pressure, family history of blood clots, history of previous STIs, all of this needs to be put into perspective before one can say, oh, this is the contraception that fits you. Because there are some contraceptives that are actually contraindicated. When I say contraindicated, you're not allowed to even use those sort of contraception if you have some particular medical condition. Again, this is something that should be discussed with the specialist. This is something that cannot just be like decided at a sitting. Is something that you should have a conversation with a specialist, and they would advise rightly, like, oh, this is what you should do, this is what you should take, this is what will better suit you and your condition. Now there's someone that said, daughter menstruation skips for like 5 to 7 months before seeing it. We've gone for medical treatment and no improvement yet. Please, what can be done? She has not engaged in any sexual activity. Thank you again for sharing this very like sensitive question with us. First of all, when girls, when they start menstruating, the first few years at the onset of their menstruation, it's usually irregular, and this is totally normal. So I'm not sure what the age of your daughter is. It depends. If she's been having her menses regularly and all of a sudden or abruptly there's been like a form of abnormality in her menstrual cycle, I would strongly consider that she sees a gynecologist. These are specialists that deal with things like this. But again, I'm just putting it out there. If we have girls, adolescent girls that have just started their period, please, most times these periods do not get regularized until after about 3 to 4 years. So it's totally and absolutely normal to have the irregularities before they now gain regularity. So if this menses has just started and you're viewing this irregularity, this is totally normal. Now, how can someone choose the right contraceptive method for themselves? This is a $1 billion question. Again, it depends on so many factors. It depends on family history. It depends on medical condition like hypertension. It depends on history of blood clots. It depends on the structure of one's uterus. There are some people that have like very terrible fibroids that one cannot even insert a copper T in it. I mean, it depends on so many things. So all of these factors put together would decide or would determine the type of contraceptive. There's also this thing out there that, oh, if I use this contraceptive pill, it's going to make me gain weight. Some of the side effects of some of these tablets causes gain weight. It is absolutely, it's a known fact. So it depends. You know, there are some people that will be like, oh, if you're overweight or if you're on the high side of your weight, we will not encourage you to use certain pills. So these are all factors that will be put in place. So you cannot just say, oh, I'm sitting down here and I'm going to swallow this pill. You need to see a specialist. Most times, all of these services can be gotten in reproductive and sexual health centers where they would advise, and nurses are very good with this. They are very experienced. They know the right, and they will tell you, oh, this is good for you. This is what you should use. So I would really encourage us, harness this opportunity. There are primary healthcare centers around us. They have all this information. They have all the facilities that can help to decide which type of contraceptive pills or which type of contraceptive method is that best suits one. Then do we have any other question? Good supports at the right time, empower choice. Oh, okay. Fantastically. Oh, thank you. Thank you. Okay, so how can someone who has high urges distract herself from the thoughts? That's a very lovely question. I like that. I mean, it is okay to have urges. It is okay to feel feel like you want to be intimate with the opposite sex. I mean, that is totally fine. Now, in terms of distraction, I wouldn't know if this person is married or married. If you're not married, I mean, you could get your books, you could engage in online activities such as reading. You could even decide to start influencing, because I know there are a lot of Gen Zs here and you guys like to influence. I mean, these are things, these are measures you could put in place. You could decide to read. You could have a structure for the day. The moment you have a structure for the day, this would help you with distractions. You will know that, oh yes, I need to achieve this, I need to achieve this. And before you know it, time is going. But the moment you are idle, that is when some of these things come to your mind and you be like, oh, I need to go and see Shegun, I need to go and see Abidemi, or I need to go and see Mustafa. You understand? So please, as much as possible, try to engage, try to have a structure, try to have like a routine, and this would help. Now, let me rephrase this question. They believe that could afford them to have unprotected. I'm not quite sure I'm getting this question. Let me rephrase this question.
Hi,
They
Dr.
believe that,
Adema.
yeah?
Yes, the question is, they believe that having these contraceptives in their body, it makes
Okay.
them have unprotected sex. I think they are not properly informed, so maybe you can just enlighten them on this, not just taking the implants in their hand. Yes, so I think that's
Okay.
what you meant in the question.
Oh, that's a very important question as well. Please, as much as possible, having contraceptives is basically just to prevent pregnancy. Sexually transmitted infection, the only way you can is to use condoms. And in fact, there's some sexually transmitted infection that even if one uses condoms, you are not protected. Things like HPV, things like episymplex virus. There was this picture that was trending online that this guy had this thing in his mouth, and it was like, oh, he engaged in oral sex and everything. So that's an example, skin to skin contact. So using pills or having implants in the arm would not protect from sexually transmitted infection. So it is important to use condoms. That is what we call dual protection. You're protecting against pregnancy. You're also protecting against STI. Condoms are the only things that can help in that regard. Again, condom is not 100% effective. Madam, you can register. Oh, okay, sorry.
All right, we also have a question that says, how often should someone how often can someone test for STIs? I know you mentioned often, but how often in time of time?
Well, this is not a question that I'm going to give like a direct answer, because it depends. I mean, if someone is not sexually exposed, why would you want to get tested for sexually transmitted infection? If you're not exposed to any form of sexually transmitted infection, I do not see any reason to go to do that. But again, one could, get tested once a year, twice a year, if there's no, if it's not like, we call them low risk. But if one is high risk, you're constantly being exposed to sexual activity, I would encourage, for every exposure, try to get tested. Again, there's another thing I'm also going to discuss, which is, a lot of people think, oh, it's sexually transmitted infection, but sometimes it's not usually sexually transmitted. Bacterial vaginosis is very common in female, whereby you have abnormal vaginal discharge, when there is foul smell of the discharge. Sometimes it could be as a result of the hygiene, the kind of underwear you're using. Cotton underwear is usually encouraged. So please, I would encourage us, aside some of the sexually transmitted infection, bacterial vaginosis is also very, very common amongst females. And please, hygiene is key. Use of cotton underwears. Try to wash with water and not soap, or all this intimate wash is not encouraged. Using intimate wash is not encouraged at all. That place is not supposed to smell like pineapple. It's not supposed to smell like strawberry. It has a natural smell, please. So as much as possible, avoid using intimate wash, because it can distort the normal organisms that are actually meant to protect that area. Do we have any other question, please?
Yeah, I think a final question is,
Okay.
How can I choose the right contraceptive method for myself? I think someone asked that in the chat.
What? I didn't get the question.
How can I choose the right contraceptive measures for myself?
Okay, I think I answered that question, but I'm ready to, I'm happy to answer it again. So choosing a right contraceptive method for yourself depends on various factors. It depends if you have any medical condition in the past. It depends on your choice, because what happens in the contraceptive clinic is they will give you an option, and they'll tell you the advantages and the disadvantages. Another option will be given, you'll be informed on the advantages and disadvantages. For example, for the long acting, like the implants, like for example copper T, once it's there, it's there. Some people they cannot withstand the procedure, because it entails you opening up your vaginal area, and them inserting like an object through the vagina into the uterus. Some people cannot actually withstand that. If you're the type that you cannot be taking pills every day, I don't think pills is meant for you, because what if you forget these pills are to be taken daily? So it depends on various factors. So I cannot say, oh, this particular contraceptive fits you or this one doesn't fit you. It depends on your own personal circumstance that would determine what sort of option you'll be going for. I'm not sure if I answered the question, but I think this should suffice. Do we have any other questions?
Yes.
Oh,
I think we have a final one.
Okay. Oh, I think
the question,
okay.
The question says, how many years could the irregular menses? I think the person means like for the younger females, the younger adolescents who just started their period.
Okay,
how
so
many years is normal
about 3 years, about 2 to 3 years, it's usually irregular, if I'm not mistaken. But I think about 2 to 3 years, it's usually irregular before it becomes regular. About that number of years, about 2 to 3 years. So I got the follow-up question about the patient, the young lady with the regular menses being 19. At this age, I would really encourage you to see a gynecologist. But you said it that you've seen gynecologists and no improvement. Indeed, sorry you're going through all of this. Getting a second and third opinion is not bad at all. If you're not getting any good or favorable answer, I would suggest you seek further help with another person. I mean, you could get a second opinion, you could get a third opinion if you think they're not addressing your concerns enough. And I'm indeed sorry you're going through all of this. I'm truly sorry about this.
Okay, thanks, Dr. Halima. Thank you so
Yeah,
much.
you're welcome. You're welcome. I
think
really
that
enjoyed
will
the
be
session.
all.
Thanks to everyone who engaged. It was really interesting. I'm really thankful. Thank you.
Thank you so much. So please, if we have further questions, we can leave them in the chat. Dr. Halima can attend to them later. Now we'll move on to the post quiz.
Please, the post quiz is up on your screen. I kindly encouraging you to please fill in the questions. We are not giving any results. We just want to know what you gained and how you're going to apply it to your everyday life. Thank you, thank you, thank you for filling it. You have about a few more minutes. It's on your screen. If you can't access it, please do let us know so that we can direct you to it. You just need to look down. There's an icon that says, there's a 3 full stop icon that says more. Just click on it and then you see poll and quiz. So you can click on that and then it pops up on your screen. Thank you to everyone that has filled it in. We're still waiting. We're still waiting. The quiz is still up. Thank you very much. The quiz is still up. Please, we're encouraging, please participate in the quiz. There are about 5, 7 questions. It will just take a little bit of your time. Thank you to everyone that has filled in the quiz. This is very encouraging. Thank you. We just have about a few more minutes to go for the quiz. Thank you very much. Thank you. We're still encouraging you to participate in the quiz. It's up on your screen. If you can't see it, please look below. You see a 3 dot that says more. When you click on it, you see poll quiz, and you can then click on it and then it pops up on your screen. But if you can't access it, please let us know in the chat and we'll direct you to it. Thank you for joining this session. Thank you for taking part in the quiz. Thank you for your questions. All right, thank you very much. All right, thank you to everyone that has filled in the quiz. I believe you can see your results now. Thank you for your participation. So the answers are showing on the screen currently.
Okay. All right, so let's go. Can we have the next slide? You can see the responses from my end. Okay. So the first was, what is the primary goal of practicing safe sex? Can you hear me?
Yes, we can.
Okay, so the correct answer there is to reduce the risk of STIs and unintended pregnancies. The next is, which of the following STIs can be prevented through vaccination? And that is HPV. Most STIs always show noticeable symptoms. That is false. Then what does dual protection refer to in sexual health? The correct answer is using condoms along with another form of contraception. Which of the following long-acting reversible contraceptives, or which of the following is a long-acting reversible contraceptive? And that would be the IUD. Where can someone typically access confidential sexual health services? So that will be through community health centers, schools and universities, and online telehealth platforms. And finally, which of the following best describes consent in a sexual relationship? Consent in a sexual relationship is when it is clear, enthusiastic, and can be withdrawn at any time. Thank you. I hope we're able to verify our responses, and we've been able to learn from the very educative lecture that we just had. Over to you, Chris.
All right, thank you very much. We're currently rounding up the session. Thank you for joining. We encourage you to please download our Complete Health app on Google Play Store. You can check on the web app, our Complete Health app, to interact with our app, to interact with our AI chatbots. You can also download Navi Health. You can also check for Navi Health online on the web to find out health and public and private facilities around you. We're announcing our upcoming Tele-Education Session. Topic is driving change with purpose, applying quality principles for measurable results, and that will be taking place on the 19th of June. Please, we're encouraging you to join us. for this session. We'll be glad to have you. Next slide, please. Please tell us how this session today has been impactful for you. There's a reaction survey that will be coming up now. Please, we encourage you, just tell us if the training met your expectations, the length of the session. Please, it just takes about 3 seconds of your time. Let us know how impactful the session has been, how excited you are about our speaker, about the session. Thank you very much. I can see the responses coming in. Thank you, thank you, thank you. Please, we encourage you to please leave your response, leave your feedback. We value feedback here at MDoc. We want to know, we want to see how we can do better, how we can meet your needs, how we can meet your expectations. So please just take our 2-second survey to give us your feedback. Thank you very much. I see the answers coming in. You can see the responses coming in. Thank you. If you're filled in the survey, please go to your Google Store and download our Complete Health app and interact with our app. Thank you very much. Keep them coming, keep them coming. We have about 1 more minute to go for the reaction survey. Keep them coming. Please, we value your feedback. Thank you to everyone that has filled this in. We value your feedback here at MDoc. The feedback is very much appreciated. We have a few more minutes to go. We have 1 more minute to spend on this survey. Please fill in your feedback. Let us know how you felt about the session, how impactful it was for you. This is a special appreciation to our joinees from YouTube. We see you. Thank you for joining. Thank you for streaming. Thank you for filling in the questions. Thank you for your feedback. Thank you for your questions. We hope that we've answered those questions that have been burning your heart, questions that you seek for solutions and answers to. Thank you. Thank you for joining this wonderful session. We appreciate you. Thank you for joining. We will see you in our next Tele-Education session coming up next week, Thursday, 19th of June by 3 p.m. Thank you very much. See you.